and I would like to uh, begin by saying that uh, 2020 has been a very, very difficult year for us, for all of us living in this planet, because as we know that from December 2019, a virus called coronavirus had started its journey from Wuhan province in China, and gradually it has taken over the whole world uh, in the span of, say, the next 3 months. So since March, it has been declared as a pandemic by the WHO. And from Indian point of view, our government had declared a lockdown for this to combat this virus since 24th of March 2020. And since then, our journey with the virus has been up and down because some states in this country had more propensity to catch the virus, like Maharashtra, Tamil Nadu, and recently we have seen Delhi, and more recently West Bengal, Karnataka. These are the states which have taken over. Even smallest, the states like Odisha, which had very, very few cases, has come up with lots of cases now. So historically, if we go back, coronavirus is not very new to this world because we have seen the coronavirus. It's actually a common cold virus, which we normally have, but it's a zoonotic virus, which means it is transmitted from animals. Usually, it is from an animal to animal virus, but unfortunately, when the animal virus actually gets transmitted to human beings, then we have a lot of problems as we have with this COVID-19 now. So the corona virus first came in 2003. That was SARS-1. It was mostly in China, Malaysia, Singapore, and I was actually working in Singapore at that point of time. So we had faced this virus, but it wasn't a pandemic at that point of time. Though a lot of people died at that point of time, but the numbers were very small because geographically this virus didn't spread to so many countries. Then came the MERS, the Middle East respiratory problems, the syndrome. So that was in the Middle East. That was in 2010 or 12. And then this third virus again came in 2019 and then 20, basically. So the number, if you see the global perspective, it's pretty high now. It's nearly 1.3 is close to 6 lakhs as of today. And if you see the Indian figures, we have nearly 1 million people who are infected with this virus and close to 25,000 deaths. So if you see the statistics, then we see that the death rates are not very high, and the asymptomatically positive patients are close to 80%. And the other good thing about this whole pandemic is the recovery rate is pretty high as well. It's close to 60 to 65%. So the good news about this virus is that even if the virus affects us, uh, being symptomatic, the chances are smaller. And if the virus affection is higher, then hospitalization numbers are also not very high. It's about close to 15 to 20%. Out of that, about 5% would be critically ill who require ICU care and possibly ventilation, and 2.5% to 3% people die at the end. So the mortality rate is close to 2.5 to 3%. But the problem is that the infectivity of the virus is very, very high, which means that even somebody is asymptomatic, that person also can spread the virus to other persons. And the other problem is that if the virus affects somebody whose immunity status is low or immunity is low, particularly the people who are in the vulnerable or high risk groups, as we say, then the virus can actually cause a lot more problems in these vulnerable groups. So who are these vulnerable groups? People who have got severe diabetes, people who have got lung problems, severe lung problems, people who have got severe heart problems, uh, people who have got cancer and are on chemotherapy, people with renal transplants or other organ transplants. So basically, persons whose immunity is low, even higher age groups like anybody above 65, people who are obese. So these are the kind of the people who actually uh, uh, have more problems when the virus affects them. Uh, the modality of transmission of this virus is through droplets. Now, there are a lot of issues which are going on right now that what are the other modalities of transmission? Can it be transmitted through air or not? So droplet infection is actually the highest modality of infection, and the droplets are caused by when you talk loudly, or when we sneeze, or when you are coughing in front of another person, and the droplets actually gets into the mouth or nose and goes into the respiratory system, because this particular virus is actually a respiratory virus which causes problems in the lungs predominantly, but it also causes a problem in the heart and other organs at a later stage. So the mode of transmission is primarily through droplets, but there are issues now where some people are telling, some experts are saying that it can be airborne as well, which means that somebody who's a positive patient and has uh, caused droplets to come out, and that drop can hang in the air, or particularly the virus can hang in the air, particularly in closed rooms. There is no evidence to say that this virus actually can move around in the air in open spaces. So these are the modalities of transmission. So the stages of transmission of this coronavirus, we know that particularly people who have traveled from one country where the virus was predominantly active to a country where the virus was not active. So that was the primary modality of transmission at first point of time, which means the travel from a country where the virus was active. Secondly, it was a contact between two people, one who is active to another people who is actually was normal. And thirdly, stage 3 is called the community transmission. So far, the Indian government has said that coronavirus has not come into the community yet, whereby we do not know where we got the contacts from. So we have advisories from two nodal bodies in the world. One is the WHO, the World Health Organization, who actually gives us advisories and we follow them. The second, for our national importance, is the ICMR, the Indian Council of Medical Research. So these are the two bodies primarily who gives all kinds of advisories which we listen to. All the experts who are doing research, these people actually give their data and inputs to these two bodies, and then they actually analyze these data and they form the advisories to us. So basically, somebody who has got COVID-19 or who is coronavirus positive and symptomatic. So what are the symptoms from which you will actually suspect that somebody has got a coronavirus? So somebody who has symptoms of cold, cough, uh, fever, shortness of breath, these are the main symptoms. But also, along with that, we have found out that people who have loss of smell, loss of taste, loss of appetite, and body pain, malaise, weakness, followed by fever and cough, they can be also corona positive in this particular days. So what I'm trying to say, that people who are susceptible or high risk patients, particularly as I told, the diabetics and the hypertensives and the heart disease and cancer patients, versus the people who are supposedly normal, the propensity of the virus to get to them is equal. But once the virus affects the population, then the high risk patients actually they behave in a different manner, which means that they can get into hospitals, get into ICUs, and their mortality rate is higher compared to somebody whose immune status is supposedly normal. So once somebody is kind of having the symptoms, and if they have contacts with people who were corona positive, or if they have a travel history, or if they are in a high risk group, then these people are advised actually to get in touch with the local medical authorities. Now, if the corona tests are positive, then the first thing is, if the symptoms are very mild, then we are advising these patients to go into self quarantine, which means home quarantine. They stay at home for 14 days, and not to mix with people who are in the high risk groups, particularly the babies and the adults and the other high risk groups. And after 14 days, the repeat test is done. And once they are tested negative, they come out. This is scenario one of self quarantine at home. The scenario two is that while in self quarantine, if these patients develop symptoms like shortness of breath, and if the fever is not subsiding with paracetamol tablets, then I think the medics has to come into play, whereby these patients probably will need admission. But if the patients are in a high risk group and the symptoms are mild to moderate, we're still admitting these patients, particularly for observation. Because what is happening is, suddenly these patients are getting hypoxic, which means their oxygen saturation levels are falling suddenly. And within a few hours, the patients are getting into ventilators or having cardiac arrest. This is one of the scary scenarios, and the predictability of who is going to develop what is not very high at this moment. So we are not able to predict that which patients is going to behave in which way. And the outcomes are also not very, very predictable. So the tests which are done to detect uh, COVID-19 or the RCP PCR test, that is actually the gold standard test. And but unfortunately, it takes a little bit of time. It's about 24 to 48 hours it takes for the test results to get to our hand. The false negativity of the test is close to 30%. Then we have the GNAT test, we have the rapid antigen test, and the rapid antibody test. But the first test which I mentioned, that is actually the main test, gold standard test for coronavirus. So the treatment at home which we recommend is actually paracetamol tablets if somebody has body aches or fever, to have plenty of fluids, and to take the medications for their particular diseases which they have on a regular basis, to have home food, and actually to be at home at all times for the next 14 days. Now, suppose somebody has to come out, then what do they do? We are recommending MSD, that is the three things we are recommending. The masking is that wearing masks to cover your nose and your mouth. That is very, very important. The second is the sanitization. The sanitization of hands is very important, because if you touch some objects which is on which the virus is sitting, and if that same hand is contaminated and is touching your mouth, nose, or even your eyes, then the probability of the virus getting into your system is high. So hand sanitization is important, and we recommend soap water. You wash your hands with soap when you are at home for at least 20 seconds and quite frequently. And if you are out of home, then sanitization with alcohol sanitizers is good enough. And thirdly, to maintain social distancing. That is very, very important as well. And social distancing, which we mean is a distance of about 6 feet from each other. So out of all these three, the most practical thing is actually the mask. And what we recommend for non-medical persons is to wear a cloth mask, a cotton mask. And because that is washable, you can wash that. And double masking is also something which we recommend nowadays. So these are the three things which you require, because besides the medical treatment which is offered, uh, the social treatment is masking, sanitization, and social distancing. Unfortunately, we do not have any specific treatment for coronavirus yet. All the treatments which we are giving right now are empirical, which means the data which has come out of the clinical trials and observational studies are not very robust yet. Hydroxychloroquine is one of the most debated drug for the treatment of as a prophylaxis for coronavirus. But the trials like Solidarity trial and other trials which have been done has not definitively proven that hydroxychloroquine works for against prophylaxis of this virus. Hydroxychloroquine also has cardiac side effects. So patients who have got cardiac problems have to be very, very careful and definitely have require medical supervision if they have to take hydroxychloroquine. The other drugs which are available are remdesivir, which are given in the hospitals. But as I told you, that these drugs have no definitive proof yet that actually they work and cure coronavirus. What they do is, so far, the reports which we have got is that these drugs actually shorten the time of the recovery. So basically, somebody who requires maybe 7, 8 days of ICU care with these drugs on board, when somebody is very sick, they are telling that the time required is shortened. The other thing which is very topical is plasma therapy. And plasma therapy is actually giving the plasma of patients who have already recovered from coronavirus. What we are doing is they develop antibodies against the coronavirus, and these antibodies are in the plasma, which is given to these patients who are very, very sick with coronavirus. And we still do not have any definitive proof that this is working. So until we have this proof, these therapies are empirical, and we have to understand that bit. And the most important, the breakthrough in the disease and the treatment of coronavirus would be the vaccines, obviously. And 119 vaccines started off their journey when the coronavirus actually started. And to date, two vaccines actually are ahead. One is the Oxford vaccine by AstraZeneca, and one is the Moderna vaccines from US. So these two vaccines are actually have completed phase 1 and phase 2 trials, and the data of the Oxford vaccine is coming out on the 20th, which is Monday. So let us see whether the data are good enough and whether the vaccines are available for the prevention of this virus. But saying so, the vaccines will take a lot of time to come on board. So we need to be careful for prevention, because the only way we can actually deal with the virus is to contain the virus. So basically, the social treatment which I mentioned, masking, sanitization, and social distancing, are the three main pillars of containment of this coronavirus. So let us take some questions now.
Sir, I had a question.
You can unmute yourself and just ask the question.
Okay, sir, my question was like we were asked to use hand sanitizers, but hand sanitizers, as I know, like they're antibacterial. So how can they stop a virus?
The hand sanitizers actually, what they do, we have a lipid core surrounding this virus. So the soaps and the alcohol, they say, actually dissolves the lipid core, and they thereby deactivate the virus.
Thank you, sir.
Doctor, hi doctor.
Hi.
Hi. My question is that is it a fact that we actually we are not aware of the fact that we are taking corona many times and it goes out of our body and we are not even aware of that? Is it true?
Yes, because these are the asymptomatic positive cases where actually you have the coronavirus, but you are not aware, and this constitutes about 60 to 70% of cases whereby we do not know that we actually are harboring the virus, and it is there in our system and it goes away. So for you, there is no problem, but you have a possibility of transmitting this virus to your family members and your friends. And out of them, some could be actually in the vulnerable population or high risk groups. So the problem is not with you when you are asymptomatic, but you can actually make other people symptomatic and serious, and even these people could die. So that is the problem with this virus.
Okay. So actually, the thing is that now that Ayurvedic systems are coming up, and there is good advice to take kara and to take this hot water with adrak and all these Ayurvedic things. So does it really work for this corona? And we take actually, we prepare the kara and we take most of the times throughout the day in order to prevent ourselves from corona. So is it really a fact that we take kara and we get rid of this disease, and we are even unaware of this thing that we are taking corona and it goes away due to kara?
See, there is no proven therapy for either preventing coronavirus or treating coronavirus yet. So, unless any therapy is proven with clinical trials, it will be very difficult to recommend that as a treatment modality. If somebody wants to take something, whether it's Ayurvedic, homeopathic, or allopathic, it really depends on the person itself. But I would always say that please do something with proper supervision. Don't just take it on your own, because a lot of things which are recommended might have side effects. And by trying to do something good, you might actually harm yourself from those particular substances.
This kara is prepared from adrak, dalchini,
Yeah, there is
green
no
tea, and
evidence, ma'am, whether it works against coronavirus. There is no proven evidence at all.
because we take that's because to prevent ourselves from these hot drinks, so that everyone says that you take hot water, you gargle hot water, you take kara, so that you keep yourself better, in a better system, better immunity system,
There is no
develop
there
better.
is no proof actually. There is no proof to substantiate this fact yet.
Okay. Thank you, doctor. Thank you.
Thank you.
Sir, does this mean that these home remedies actually do not work well and also cause damage to us? Then does this mean that?
No, I am not saying that home remedies cause damage, but what I'm trying to say that if you take home remedies and you think that you are protected, there is no evidence yet to say that you are protected. So even if you take
Okay,
home
sir.
remedies, you must take the protection which is recommended by WHO and ICMR. That's the most important thing, because so far
Okay, sir.
no drug, no vaccine has come out for treatment or prevention of coronavirus. So as long as they do not come out, you can take your home remedies, whatever is you feel correct, but at the same time, please take adequate precautions as recommended by WHO and ICMR.
Hello,
Good
sir.
evening, sir.
Good evening.
Sir, my question was, do you recommend any kind of vitamin tablet in this situation?
Yes, vitamins have been recommended, particularly vitamin C and zinc. But you have to be careful about taking the dose of vitamin C, because the vitamin C tablets are available at 500 milligrams and 250 milligrams, but that's too high for particularly this kind of a problem. So I would recommend a multivitamin where actually, or even lemon is good enough, where actually you get adequate amount of vitamin C, but not overdose of vitamin C.
My father has a diabetes, so he can take that.
Yes, he can actually. Yes, he can.
Okay, thank you, sir.
Thank
Hello,
you.
sir.
Yes, hello.
Sir, I have a question, sir. That there is how much possibility that there is a person could caught COVID-19 twice? Because a new case study showing that immunity to the virus is short-lived, and yesterday BBC News said this. And so, what is your opinion about it?
Yes, we have had recurrences of these viruses because the antibody to the virus, to the virus is actually not as long-lived as like a chickenpox virus, which you get once a lifetime. So So what the research has told so far, that about 60% of patients actually have good activation of the immunity, which means the antibodies are formed. But for a lot of other patients, say about 30-40%, the antibodies titers are low or weak, which means that once the antibody goes off from your body, you are again have the risk of contacting the virus. So that's the problem with this particular RNA virus, the coronavirus.
Yes, sir. And what's your opinion about Covaxin that India is making the vaccine and they're claiming that they will launch it in 15th August? But this is possible because they will take a lot of time. They haven't
No, I, I,
issued
I
the.
think there's a miscommunication about that letter, which has been clarified later. I don't think as anybody has claimed that the vaccine is going to come out on the 15th. What they have told, the phase 1 and phase 2 trials will be starting on 13th of July. And the trial results, it will get over by 15th of August. I think that's what they tried to say, because as we know that phase 1 and phase 2 trials are very, very important, which evaluates the side effects of the vaccine, and it evaluates the efficacy of the vaccine. Once it is done, and it is done in a small group, so once they are done, then they will go to phase 3, where actually more people will get exposed to this vaccine, and then the phase 4 trial comes, and after that the licensing comes, and then the manufacturing comes. So it's a long way out actually.
Yes, sir. And Russia is now claiming that Russia had invented the virus and they will launch it soon. So is it true or is it possible?
See, every country in this world will try to launch a vaccine. The vaccine is not a very big drug or anything like that. It's actually a part or inactivated virus. That's what it is. But how you actually develop the trials and how you actually analyze the phase 1 and phase 2 trials, that is going to be the most important thing, because the analysis of the trials and the results of the phase 1 and phase 2 trials are the most important thing actually, as far as the vaccines are created. Because if your phase 1 and phase 2 trials are good, then the phase 3 trials comes into existence. If they are not validated, the phase 1, phase 2, the phase 3 doesn't come into existence. You have to also know that the earliest vaccine for any viral disease in the world, for a pandemic, has been 9 years, which was probably the measles vaccine. So that is the earliest a vaccine could be produced. So expecting a vaccine to be produced in 6 months to a year is actually a very, very tall order. It is kind of a miracle if it happens, but we'll be very happy if that can be achieved.
Sir,
Yes.
sorry to interrupt here. Before anyone asks any question, we are left with only less than 3 minutes for this first session. If we get lost, so may I request everyone to just click on the link again so we can join again.
Okay.
So we are left with 2.5 minutes.
Okay.
Good evening, sir.
Yeah.
So is there any clear-cut division or criteria which will decide actually that a person, whether he has to stay in home quarantine, or it would be more likely to get admitted in a hospital? Is there any clear-cut division like that of criteria?
I think I discussed that in my while I was giving that lecture, that who are the people who are in home quarantine and who are the people who should be admitted to hospitals. There's a clear-cut division. We have some criteria definitely to distinguish between home quarantine and hospitalization. So if you go back to my lecture, I'm sure you will understand what I have told.
Okay, sir, thank you.
Doctor, am I audible?
Yes, I think Mr. Vikash is actually asking us to leave this and go back
Yeah.
and
Okay.
re-enter again. So let's do that.
Okay, thank you. Thank you.
Okay,
Thank you.
please come back, all of you.
Okay.
It started.
Okay.
So
Yeah.
my two questions are, first is with the hand sanitizer. So is it that some people are saying that you have to use hand sanitizer having at least 70% alcohol content? So less than 70%, will it kill the virus or not? Or is it compulsory to have 70% plus alcohol content in the sanitizer? And second one is, new studies or the findings talk about the virus being in the air. It is
Yeah.
traveling through the air also.
Yeah, as I mentioned, that 60 to 70% alcohol is required in the sanitizer. That's what the recommendation is for it to inactivate the virus. But the easier way is actually if you are at home or if you are at workplace, to use soap, because soap definitely inactivates the virus. That is known. So washing your hands with soap for 20 seconds actually can inactivate the virus very, very well. If you are traveling, maybe that's a good time if you want to use your sanitizers. That's the first part. The second part of the question was, does it travel in the air? About 239 experts actually put their recommendations to WHO to consider whether the coronavirus is actually airborne or not. Because all this while we knew that the coronavirus is transmitted through droplets, which does not carry very far, maybe 2 meters or 3 meters, not more than that. But some experts believe that it is airborne. But what has come out in the experts' opinion is probably in a closed room, it is airborne for a while, but for how long it is airborne, nobody knows that. And particularly in open spaces, they say that it is not that airborne. So people are recommending that it is better to open your doors and windows and have the ventilations going, cross ventilation, while actually you're working or you're sitting in a room. That thereby actually the chances of the virus stagnating inside a room and getting transmitted to another person becomes low.
Sir, relating to this only, one more thing was, if you are in a close proximity to a affected person, uh, without a mask or with mask, so for how long being with them and talking loudly or anything can get you affected?
There is no definite proof of how long it takes, but definitely if you're without a mask and if the other person is uh, positive, a corona affected patient, then definitely if the droplets or if he sneezes or coughs or even talks with you and both of are without mask, then obviously the chances of transmission is extremely high, because this is a very contagious virus and it contaminates the other person very quickly. So it is not only important that the person who is infected wears a mask, but I think it is also important that everybody wears a mask. And definitely when you are in a workplace or when you are in a place where you are more than one person. Now I'm in a room alone, so I'm not wearing a mask. But definitely if I'm in a room with more than one person and I'm talking and interacting with that person, I have to wear a mask.
In the network, we are saying that they are always trying to tell the virus is airborne. In our locals, in the flats, someone is using in the terrace the mask. So it is useful when I am walking to in the terrace. It is to use mask. It is necessary to use mask at my terrace.
Of course, if somebody else is there, you have to, because if that person is standing and talking to you and you are not wearing a mask, then the chances of getting the virus is higher. Nobody knows exactly when the virus is going to come from another person, but the only way you can prevent is because the virus gets into your body, into your lungs through either the nose or the mouth. These are the two main places, entry points. So if those two entry points are actually covered, then the chances of you getting infected from another person is very high. But if you are saying that you are an empty terrace and nobody else is there, what are the possibilities of you catching the virus? Obviously, it is very low. But I think when you are getting out of home, make it a habit, because this is going to be our new normal. That masking is going to be there for quite some time now. It's not going to go out very quickly, because we know that we have to live with this virus for quite some time, particularly until the vaccines are found out. And believe me, once the vaccine comes out, the developed countries will get the vaccines much earlier than actually the developing countries. So basically, when the vaccine is going to come to us, how long the vaccine's immunity will be conferred to the patient, we do not know that. So the only cheap way of actually containment of the virus is through masking. So we all have to make it a habit to use the mask wherever we go, because most of the times we see the masks is actually not worn properly. So that habit has to be developed within our psyche.
Thanks.
Sir, there is one question for you in the chat box.
Mm-hmm. If you read the question, please.
Sir, the question is, the antibody body is short-lived. Does it mean we can't expect to have a natural growing immunity against it?
Yeah, I think this is a very difficult question to answer, because all the experts have been saying is that this is not a long-lived immunity. The antibodies strength weakens very quickly, unlike many other viruses, as I mentioned, the chicken pox and all, which gives you a lifelong immunity. For sure, this particular coronavirus so far has been proven that it does not yield even a 1-year immunity sometimes. So these are a lot of questions we need to answer, because we are only, say, 150 days into this viral story. So it will take some time before we actually understand the virus. The other problem with this particular virus is, because this is an RNA virus, it is mutating very quickly, which means it is changing its shape and form to actually attack the human bodies as it wishes. So the virus is actually 1 or 2 steps ahead of whatever we are trying to do. That is the problem with this particular virus.
Sir, I had a question.
Yeah.
Sir, suppose like after a person cures from the virus, has there been any recorded after impact on the body that may be dangerous later on?
Yes, what has been proven actually with some small studies, that even if somebody is asymptomatic and positive, that person's immunity level is actually becoming low compared to somebody who does not have the virus. Which means if your immunity is low, your propensity to catch another viral disease or any other bacterial disease becomes very, very high. So there is a problem with that particular area, that the immunity to this virus and the whole body immunity gets depressed once somebody is coronavirus positive, even if they come out of it without any symptoms.
Sir, I mean, doctor, if the virus is mutating quickly, which means that is it still mutating as we speak?
I think so. That is the way things have evolved since Wuhan in December 2019. That the mutation of the virus is causing the problems, and that is one of the primary reasons why the vaccine development is having so much problems. The mutation, because we know very well that compared to a RNA to a DNA virus, the RNA virus mutates much more than a DNA virus does. So in this particular case, coronavirus is the RNA virus, and the mutation is actually one of the main problems.
If the
Doctor,
virus
just
is
one
mutating,
question. Just one question. That
Yeah.
have we already reached the peak, or it's like peak is yet to come? Like we're already in the worst situation, or the situation might get worsened day by day?
I wish I could answer your question, because I think if I could answer your question correctly, I would not be sitting today with you today. I would be in a much more bigger audience talking about this thing. The answer is we don't know. I think the peaking word is actually a misnomer, because this is not going to be a peak. This is going to be a height from where actually a plateau will happen. A peak is something like this, which goes up and comes down. That's a peak. So here, I think height will be reached, and from there, a plateau will be there. So how far we are to that height, it's still very unknown, because the reason is every day so far, more and more cases have been reported compared to the previous day. So obviously, we have not reached the peak. But whether we have reached 50% of the way or not, we still don't know, because Japan, Korea, Australia, where actually things were negative, they still started having the recurrence of the problems, which is called the second wave. So maybe we are not near the peak yet, particularly definitely not India right now. Maybe it will take a few months more to achieve that place from where the plateauing of the peak will happen, and after that the fall will happen. But
But
when it is going to happen, we don't know that.
Good
and
evening,
our
sir.
healthcare
Sir.
facility is more or less like sustainable for this type of a peak. I mean, for a plateau, or we are not still deficient of this in India?
Well, not only in India, I think we have known that when it actually hit the European nations, particularly developed nations in Europe, we saw the pictures which were transmitted over the television that people were dying in the streets. So basically, the world was never in a position, or they never actually had the infrastructure to deal with any such pandemic of this proportion ever. So to answer your question, no, we are not. Our infrastructure did not allow us actually to have so many beds, particularly for this particular disease. But saying that, the government of the world, the Indian government, our state government are actually in a war footing, trying to create more and more beds. But just creating beds is not sufficient, because as we know, the beds has to be manned with equipments and personnel, the doctors, the nurses, the paramedics, which anyway we were in a shortage to begin with in a pre-COVID era. So particularly now, things are very, very tight, but everybody is on a war footing. We see every day cases of patients being refused in hospitals because of lack of beds. But I think in days to come, probably more and more beds will be allocated for this COVID patients. But saying that, the more beds we are allocating, the more patients are coming, which means, as I told you before, the virus is 2 steps ahead of us. So once the vaccines come, when and if it comes, that will be the time when actually the people can be prevented from having the disease. That's the only way. Until that time, the masking, sanitization, and the social distancing is the only way to contain the virus, unfortunately.
And what is the
Sir, good
earliest we
evening,
can
sir.
expect a vaccine?
Sir, it is
Earliest.
sir, my friend who was admitted in
Sorry, come
hospital
again?
in Odisha, Barampur. Sir, he was admitted for COVID, but he said that most of the people who are
Yes.
admitted, after 6 or 7 days, they were discharged without taking of any medicines or any precaution measures. So here my question is, if some mild cases are being admitted now in Odisha, why not they are being kept in home quarantine?
Yeah, I think that call has to be from the government level, because the health department of the particular government will take a call on that, which cases to be monitored at home and which cases to be admitted to hospitals. That cannot be a specific overall rule for anybody. I think depending on your resources, depending on your allocation of beds, depending on your health personnel, you
Coffee,
admit
they were
patients.
being
But I'm
discharged now.
saying that
My question
the
is,
mild cases, we
just
do not
why
have any
they are
specific
staying
treatment.
5 to 7 days in hospital rather than staying at home quarantine?
Yeah, that is something which the government of that particular state has to, they have to kind of discuss and come to a conclusion as to how long they're going to keep a patient. That cannot be a prerogative of a medical professional by any means. Because as I said, that we do not give any specific treatment when we are
Person
admitted in a
is,
hospital. We are only giving supportive treatment.
Okay. Supportive,
Sir, I had a
supportive
question.
treatment means, sir?
Oxygen therapy, fluids, and basically observation. That's it. Nothing more than that we are doing right now, unless the patient is admitted to intensive care, where we have to give a higher form of treatment like ventilation and ECMO therapy and plasma therapy, heparins, and other drugs. But those are still not targeted therapy for coronavirus yet.
Okay, sir. Thank you, sir.
Sir, what is the earliest we can expect some vaccination for this?
See, the time frame is very, very difficult, because as I told you, the measles vaccine is the earliest we got, which took about 9 years. The other took about 18 years, 30 years to get a vaccine. And the SARS one, which happened in 2003 because of coronavirus, and the MERS which was the Middle East virus, those two have not yet have any vaccines. So basically, expecting a vaccine within a span of 6 months is a nearly impossible thing. But phase 1, phase 2 trials happened in particularly two vaccines, which is actually the Oxford vaccine by AstraZeneca and the other vaccine, Moderna vaccine in US. So those two have completed the phase 1 and phase 2 trials, and the results of those trials are expected next week, particularly the Oxford vaccine. So let us see and wait whether everybody's trying, to get the vaccine. Everybody's trying.
Thank
So,
you,
but we
doctor.
have to have it very safe, and it has to be very efficacious. So that these two things has to be balanced properly.
Good evening, sir.
One second,
So,
Ronak. Ashok Kumar ji, can you please mute yourself? You have not muted yourself after asking your question. Ashok Kumar Patnaik ji, can you please mute yourself?
Sir, sir, can I continue?
Yes.
Yeah, please continue. Smita, can you mute Ashok?
Good evening, sir.
Yeah.
Sir, my father is an arthritis patient and he has been prescribed the sulfasalazine drug. So, what is your suggestion about him for taking precautions against coronavirus? As per
See,
I have
if
searched in the
he's
Google.
actually having an immunosuppressive drug, so he falls into high category, high risk category. So basically, he should not expose himself to anybody who is positive, and definitely he has to take extra precautions of masking, sanitization, and as distancing from other people, particularly in this particular times when the coronavirus is so rampant in the society. So he should not be moving out of the houses if it is unless it's an emergency, and take the other precautions which is required and take his medications properly.
Sir, ought he to carry the same doses of the sulfasalazine, or he have
That
to
I think you need to talk
recommend
to your doctor who has prescribed him, whether he needs to take the same dose. But for in this scenario, there's no requirement to either make any changes of the doses because of the coronavirus. The disease itself will determine how much of dose of the drug he is to take.
So there's another doubt that I've heard that the coronavirus mainly starts its affection to the body through the lungs, and where the AC angiotensin converting enzyme acts as the receptor. Say, is it true?
Yes, because this is a very interesting question. The reason is because the young people who are affected, we thought that the age is actually for them, but smokers who actually who are young, they're affected, and some people are actually dying out of it. So that is a source of worry. And the ACE thing which you mentioned is actually one of the reasons. So particularly who are smokers, they have the damage to the lungs, and particularly the ACs actually the levels are very high, which is causing the virus to actually act on these lungs very severely and causing a lot of problems and complications.
so I have a doubt, sir. So if the virus, antibody against this virus is short-lived, would it really make sense to make a vaccine for it? Because if so, all attempts will fail, I think.
See, it is short-lived in a particular percentage of patients. We still do not know until the phase 1 and phase 2 trial results are not out. We can never say. And unfortunately, the phase 1 and phase 2 the trials are done on a very density of population. No trials are actually complete. So that is the problem. So let us take one thing at a time. Let the phase 1 and phase 2 trials results come out, and then the phase 3 trial will actually be done on a very on a bigger population, and the phase 4 trial is done in a much higher population. So once the bigger the population size, the better your results are going to come. Then only we can tell whether the vaccine which has been taken out is actually effective against coronavirus or not. So far, we have the speculations and the postulations which are on paper, but to bring it to practice, I think the trials and the phases of the trials have completed and the reports have to be analyzed.
Yes, sir. Thank you, sir.
Sir, a few minutes ago, you said that this virus is constantly mutating. Then does it means that there won't be any stable vaccine as because it's constantly mutating and getting stronger?
It is a difficult one, I think, because even if it mutates at some point of time, the virus actually it fades away. That's the natural history of a virus. So even if it's an RNA virus, it is constantly mutating. At some point of time, the virus will gradually fade away. The problem with there was a question of herd immunity, which means that 70% of the population, if they are infected with the virus, then you achieve a herd immunity, which means immunity in the community. And then the other people are actually safe because the virus does not have the same effect anymore. But because of the mutation, constant mutation, achieving a herd immunity is very, very difficult. So that is another problem.
Sir,
So
there was
doctor,
one
even
question in
if
the
a yeah,
chat box. So there was one question in the chat box. I think you already answered it, but still I'm asking it. So the question is, when we are out of house, we are using mask, but in air conditioning room or refrigerator and all these things, they are saying that there is still a possibility of coronavirus. So how to protect us from this condition?
See, I mean, these are all postulations and speculations that the virus attaches itself to different surfaces, particularly the metallic surfaces and plastics and woods and all those things. So wiping surfaces with even plain soap water sponges is good enough. Uh, but if somebody is positive, you think inside the house, then it is better to use the masks even when you are inside the house, because a positive patients always have a chances to actually propagate the virus to different areas of the room. So I always recommend that somebody who is positive to wear a mask even if that person is inside the house, because if you don't infect the person who is in contact with you, but definitely you can always, if you cough or sneeze, the virus can actually go on to inanimate object, and uh, unknowingly the other person can come and touch that, and through that the transmission can occur. But we do not know how long it actually stays in a particular surface. It's a speculation which has been told that it stays a few hours in the surface.
So I'm curious about a question that there's a rumor like China is responsible for this pandemic. So what do you think about it? It is a rumor or something else?
I really don't know. I mean, we have been privy to the rumors, which you are as well. But I must say one thing, that besides this pandemic, which has caused a panic amongst us, there's another problem which I always feel is the infodemic, which means the information which is being transmitted through the social media. That is something which we have to be very, very careful about. Because I always tell in different forums during this pandemic is something which we can control, but infodemic is something which is beyond our control. So many informations are being transmitted through social media, WhatsApps, Facebooks, and Twitters, and Instagrams, and everything. So we need to be careful which information we're actually wanting to take. I always tell the WHO and for Indian purpose, the ICMR are the two main bodies who are actually assimilating all the data and transmitting that on a daily basis. So let us just focus on these two bodies and see what they are saying. They might be right, they might be wrong, they might change things from day to day, but that does not matter. At least we know that this is a consistent body which deals with scientific things, and whatever they are trying to come out with is probably the best thing which they have for the society.
Good evening, sir. So
Good
actually
evening.
now nowadays we are seeing that the number of COVID patients in New Zealand is almost nil, and in India there is drastic rise. So what's making the difference? Is it the population density or the temperature? What's making the
New
difference?
Zealand has got more sheep than people. That is New Zealand for you. And you cannot compare New Zealand with India, because India has got the highest population density in the world. And the cities, particularly the metropolitan cities in India, Probably New York is the only city which has got more population density compared to any other metropolis in the India. So New Zealand, the containment in New Zealand was good, but the resurfacing of cases again started, but they can contain because they are in a corner of the world. The people population is less, so there's a possibility. But for us, it's a huge challenge with the population density we have. But I think the numbers which we have compared to anywhere in the world, in particularly Europe and all, is pretty good. But we need to up our awareness much higher, because what we see on a day-to-day basis that people have given up sometimes, so it's a mental game as well, because mentally people are fed up with staying at home, being locked up. This is not a usual human behavior. So we need to actually access the information and to see and to be mentally stable, because the physical bit is something and the mental bit is actually much higher. We see the violence at homes, the suicides have increased, the depressions have increased, particularly students, which I'm addressing today. They are in the forefront because the online teaching is something where you can learn something, but school is actually, and colleges are actually something different, where you go not only for teaching purpose, for learning purpose, but also to have interaction with your peers, with your friends, with your colleagues, with your teachers. So this is a different ball game. And students so far, even if our world has opened up, but the educational institutions all across the world is still closed. So it's a huge challenge for my fellow students during this COVID times. So I say that whatever interests you, please try to do that, because the world in a year or a couple of years is going to be back to normal again. So please wait for that time to come, because if you become kind of impatient, you cannot do anything, because nobody can do anything about it. Because if the schools open, colleges open in the midst of this pandemic, it is going to give an explosion of cases, and particularly for the young population, which is going to be a catastrophe for the world. So that is the reason the schools and educational institutions will be the last to open. So we'll have to, all the students have to wait. Online teaching is very good, but you have to actually increase your awareness, try to become leaders in your group to make other people aware through online platforms. And you are actually magicians with your social media groups. So try to have more interactions with people, try to get more people on board to understand about this disease, and how to make people aware of what to do, what not to do. You are the best ambassadors, believe it or not, because you can do it to your peers. You can actually do it to your parents as well if they're making a mistake, because you are so observant, so perceptive. And I salute this young generations, because they're much more intelligent than what we were at your age, believe me. So my appeal to the young generations, to the students, is that you take a lead in this fight against the corona as well.
Sir, I wanted to ask that is it true that the virus can also transmit from patients who have died from COVID?
Yeah, this is a very pertinent question, because the society actually is creating a lot of problems for the COVID patients who are dying after being exposed to COVID. But there are a lot of kind of regulations as to how the COVID deaths, the bodies are going to be cremated. Every government actually in the state and the centers in different countries have different standard operating protocols to get the body cremated, whether it's burial, whether it is a cremation, funeral. So basically, it is important that the public and the population at large actually cooperates with the government and not to spread panic, because after all, somebody has died, we have to give dignity to that death as well. We cannot just throw them away. We see a lot of pictures in the televisions where actually people are just so scared that they're throwing the bodies away, not taking the bodies. I think we have to be careful that we need to give dignity in death as well. So please follow the guidelines which the government has actually given. And once it is done properly, believe me, there is no danger from that.
Thank you very much.
Sir, just for the information, so we are left with another 8 minutes for this session.
Okay.
So we can close the session after this. So those who have any questions or anything, so you can ask
Yeah,
another 8 minutes.
I have a
there.
question from Bipasha Roy, who is asking that how can you take out the stigma? I think this is a social area which needs to be dealt with. And I think the public education is a paramount importance. And as I mentioned just a few minutes ago, let the young generation take the charge of the public education, because you are empowered people now. You are magicians in the social media. You know computers, you know smartphones like nobody else in this world, really. We struggle with the technologies, but you are kind of wizards with that. So you take it on yourself to take this awareness campaign to different sections of the society. Once people are aware that this is actually a disease where today somebody else has it, tomorrow I can have it as well. So you have to be compassionate and have empathy to your fellow beings, even if they are COVID positive. And I would say that it's the other way around. You don't have to go and meet that person, but make sure that the person feels comfortable when that person is actually COVID positive, because they feel very left out in the society. So my appeal to the young generations, to my students, is that please take it on yourself to inquire about your neighbors online. Definitely, you don't have to go physically, but please make a phone call, make a video call, so that they feel also connected. Once they know that this is something, just only a disease and no stigma attached to it.
So one thing, so you're recommending us to follow WHO, but nowadays WHO is being called like bias to China. Can you, sir, please tell us some recommended news website that we can follow? Because sometimes it happens that we are sharing a wrong news to my friend. So you can
No, I
recommend this
don't
news
think we
website
can say
like.
that, because I think this is a part of infodemic. You know, we have to believe what WHO says, because whether they are biased or not, that is not for us to decide. But whatever the WHO says has to be the ultimate. And also we have the ICMR as well. So basically there are different levels in the global body and in the national body as well. So WHO and ICMR has to be the two nodal bodies which we have to follow their guidelines from, as far as the COVID is concerned.
Please recommend us like website, news website which can we follow for authentic news actually.
I think WHO and ICMR are the two authentic sites I can recommend anytime, because they are the people who are the frontline, media warriors in this war.
Thank you, sir.
Sir, I have one question for general things. Basically, we are talking about wearing the mask, and mask also we are insisting on the cloth mask, which is reusable and washable. So, coming to the cloth mask, some people are wearing the handkerchief on the mouth, or some people are using the 2-ply, 3-ply. So, what type of cloth mask is recommended for the
Any
safety?
cotton mask is good enough, but particularly if you have 2 layers, it is very good. Then even if you are somebody's covering with a handkerchief, if somebody doesn't have a mask and covering with a handkerchief, it is better than not covering it at all. So the important thing is that this cloth mask, or cotton mask, or even whatever materials you use is washed and dried in then it is actually reusable thing. But surgical masks and N95 are only meant for medical professionals and carers, healthcare workers only, or general population who are taking care of corona positive patient.
Thank you, sir.
Sir, I had also a
Yes.
question that is it true that we are more susceptible to COVID during the monsoon season?
Yeah, this is something which is coming up, that the monsoons are coming. We're more susceptible. England, UK has just given a warning yesterday that in winter of UK, the chances of COVID is going to be very high. Anything which causes more humidity actually has the virus to spread very quickly when something is very humid. That is the whole idea basically. So during the monsoons, our relative humidity is high. During the winters, again, the humidity, though it is low, the temperature is low. So basically, those are the two factors which people think that propagates any virus, not only coronavirus, but any viral fevers and viral problems actually happen more during those periods compared to a summer, which is much more drier and hot.
So maybe we can take one or two more questions because we are left with only 2.5 minutes.
Okay.
So maybe at last one or two questions, then
just take one more question and then we can sum up. Yeah.
Yes, sir. Any one question anyone wants to ask? So there is one question in the chat box. So
yes, please ask.
Question is, people are more panic stricken than they are supposed to be. Could it be considered as disease like bronchitis?
Panic is one of the things which is bound to happen. This is a part of our psyche where things which you don't know causes more panic. When you go out in the dark, we don't see anything, we panic. So this is something which is a much more bigger, because we are losing people, and we do not know. The problem is that we do not have any predictability value for this disease. We do not know exactly how this disease is going to come out, who are the people who are going to be affected by the disease, if they are affected, what is the outcome of the disease. So there are a lot of questions which don't know. We also don't have a treatment for the disease. We do not have a vaccine for the disease. So the net reality is that we are 0 out of 10 when the disease is there. The only thing we can do is to contain the disease right now. So the panic situation is there, which is a natural thing, but we have to overcome it with our information and the proper methodology which we have right now. I'm sure in days and months and years to come, we're going to get out of this problem, and the world is going to be as it used to be before, but better, I'm sure, because we are much aware and we are sensitive now to, and we don't take for granted anything in this world anymore, that anything can happen. So we will become better human beings in days and years to come after the COVID thing is over.
Sir, we are left with less than 40 seconds now, so we can.
Okay, so let's round up. And thank you very much, Vikash and Dr. Anupama Shetty and the Narayana group for having this wonderful interactions with our young students, because I believe that they are our beacon in the fight against Corona.
Thank you, sir. Thank you to you also, sir, for taking this wonderful session. We have recorded this session and we'll be sharing the recorded link also with all the people who have attended.